We will continue with our second panel for the day. I would like to first of all welcome Dr. Yahya, who will be moderating this panel, Focus Iraq Health Crisis Management. Dr. Yahya is a member of the FKBMS and is specialized in internal medicine. Welcome, Doctor. We have Mr. Kwang Chin Choi, who is a panelist and is the Consul General of the Korean Consulate in Erbil. Welcome. And I'd also like to welcome Dr. Faris Berfkani, who is also a panelist and is the Vice Chairman of the Parliamentary Health and Environment Committee. Welcome, Dr. Faris. I would also like to welcome Dr. Afrasiab Musa Yunus, who is the Director General of Health in Duho Governorate. Welcome, Doctor. I would also like to welcome Dr. Wael Hatahit, who is the WHO Iraq team leader. Welcome, Doctor. Dr. Yahya, the floor is yours.
Thank you very much. I am Dr. Yahya, fellow of Kurdistan Board for Medical Specialties. I'm a specialist in internal medicine, and I am honored to moderate this session. First of all, I would like to each one of you to introduce himself briefly, starting by His Excellency, Mr. Kwang.
Okay. I was requested to introduce Korea's success story to fight against coronavirus, which features the no lockdown and the creative ideas on the basis of the IT technology, and that drew a lot of global attention and went to headline by the global media. So I would like to introduce Korea's success story on this occasion. First of all, I'm very delighted to deliver my presentation to all of you. I wish that my presentation will be of help to not only to the Kurdistan, but also all the people in whole Iraq.
Thank you, Mr.
First of all, can you show my presentation on the screen? Sorry, because of the time limit, I would like to make a very speedy presentation. I expect that everybody will listen to carefully. But there are many cases I would like to introduce, but I would like to select several essence of our success story. It's a little bit difficult to introduce. If you look at the screen, Korea is a vibrant democratic society and rely on international trade and flow of people, goods and services, and has robust healthcare system. As you are well aware, Korea already experienced 2003 SARS epidemic and 2015 MERS epidemic. So we have a very strong and healthy care system to cope with any epidemic occurring anywhere and at any time. So we are ready to cope with any epidemics. And we have also advanced ICT infrastructure and relatively high civil responsibility. It means that in times of a financial crisis, Korean people, they collect their old gold to the government to pay the debts. At the time, Korea was suffering very difficult, hard time in finance situation. The old people, they bring their gold to pay national debts to foreign countries. So our Koreans are very ready to cope with any difficulties occurring anytime here and there. Second, because of this, Korea's control strategy towards the COVID-19, from the beginning, we took a very preemptive and rigorous and innovative strategies on the basis of the openness, transparency, and democratic values. And then I would like to introduce the 3 T's. This 3 T is the abbreviation of the test, trace, and treat. These 3 T's are very popular last year, and then all global media they introduced these 3 T's. Why 3 T's? I would like to give you some example. If there is information that in this room there is an infected patient, what is the first response from the government side. Maybe the Kurdish government, they would like to test everybody here, and then they identify one person who are infected. They would like to invest the people he met and the place he visited, and then all the routes he has been moving around. And then if they found out any outcome of the investigation, they would like to inform this outcome to all the public in the Kurdistan region, and then let the people take a necessary measure to get over the coronavirus. So, and then after that, the infected person are identified. Maybe he will sent to the hospital or to be quarantined according to his severity of his COVID situation. So that's why this test, trace, and the treatment is very logical timeline, and then very important to cope with COVID situation all over the world. That's why these 3 T's draw global attention last year. And then I would like to introduce one by one, but I think everybody here may already have this information in advance, so I would like to focus on the innovative things only, because this year's summit is focused on the research and innovation and the development. So I would like to more focus on the innovative things. First, testing. Okay, testing. So in this testing stage, what is most important thing is that to take as many and speedy tests as possible. That is the very, very important thing. So in order to tackle the coronavirus, Korean government took the fast-track authorization of test kit and innovation in access to testing and the free test for suspected patients, including foreigners. If you look at the photos on the right, there are 2 photos shown on the screen. Number 1 is the drive-through testing station. This idea was created by the local medical team in Korea, and then this idea was accepted by Korean government and spread all over the world. And then all over the world welcomed this idea, and then all global government followed this suit. So that's why this idea was created by the Korean medical team who are working in the local area. So I think this is a good example for the Kurdish people to follow, whatever there is difficulties to cope with. And second one is the walk-through testing station. This one is also created by the Korean citizen. So to tackle down the COVID-19, not only the government, but also the citizens, they became one team, and they raised their ideas, and through the brainstorming, they have very effective response to the coronavirus. Okay, if you look at the screen, this is the tracing stage. In this stage, what is most important thing is that if there is an infected case, the government should investigate where he visited, whom he met, and how he moving around before he infected. So that's why Korean government took a very active measures to track this kind of sources of his all information, and then as soon as they got the information, they distribute to the community. And then all the people in the community, they should take the necessary measure. So Korean government send text messages through the cellular broadcasting system. It means that whenever there is a cases, it is shown on the mobile phone. So the local government send this information to the whole community in the provinces, in the city. So even while in Korea, I received several text messages from the Seoul City Municipality Authority. And then if I visited this place, or if I met this guy, I should go to the testing station and I have to check with the coronavirus situation. And secondly, if the patient was confirmed, the infection is confirmed, he should download self-quarantine safety and protection application. If you look, this is the photos of the application. So while they are quarantined, they have to download this application and they have to check their temperature 2 times a day. And then the government officials give him a call 2 times a day and 1 time from the AI. So AI call to the patient and check his temperature and abnormality in his physical condition. And AI receive an information that this guy is a little bit abnormal situation. And then the government official take another measure, send him to the hospital or something like that. So this is another good example of the Korea's trace stage. And finally, we have a treatment. Treatment means that if an infection case is found, this person should be healed as soon as possible, according to his severity of the corona situation. If it's very serious, maybe he should be sent to the hospital, or if he's very mild and simple, maybe he should be self-quarantined, and he should be monitored by the application as I shown before. Sorry, I didn't show. Treatment, yes. Okay, this is treatment. This is simple, so I would like to skip. Okay, all in all, the Korean government's response to coronavirus can be characterized these 5 things. Number 1 is transparency. Number 2 is robust screening and quarantine. Number 3 is unique but universally applicable. Number 4, strict control. Number 5 is treatment. So we call it trust campaign. And then on the basis of this trust campaign, our government sent this very important lesson to the foreign countries on this kind of trust campaign. Number 1, T is transparency and responsibility, united action, service and speed, and together in solidarity. So, as I mentioned before, to fight with the coronavirus, most important thing is the government and the people should be one team. And then, if there is any idea, creative idea, they should raise. And then, this idea can be shared not only by the government, but also the citizens. And then, we have a very team response to the coronavirus. So from the 1, 2, 3, 4, TRUS is the domestic action, but what is remaining is the together in solidarity. Means that coronavirus cannot be won by one country because this is the international issue. So Korean government took a very active role to fight against the coronavirus, especially with the UN organization. So I would like to introduce that UN Secretary General, he one time mentioned that it is essential to have international cooperation, coordination to win against the coronavirus. To put this into action, Korean government, especially our president, he announced Korea's policy to cope with globally coronavirus in the UN, G7, G20, EU, ASEAN Plus 3 summit, and the telephone calls with the head of summits, etc. And we strongly put the emphasis on sharing Korea's control strategy and lessons learned, and closely consulting with other countries and with the WHO and the UN, and supplying test kits to other countries, and providing humanitarian assistance worth $100 million, and the funding for COVAX AMC worth $200 million. And we already provided humanitarian assistance to more than 125 countries. Finally, I would like to focus on the vaccine policy. Our president announced last month that we would like to become one of the top 5 countries in vaccine production in 5 years. In order to do that, we would like to invest $1.9 billion over the next 5 years and to form global partnership with other countries and international organizations. And domestically, we are expecting, we would like to produce vaccines, our Korean vaccine, within the first half of next year. Thank you for your attention.
Thank you, Your Excellency, for this nice example about how a country manages the health crisis. We are now almost 2 years into COVID, and this pandemic has left us with more than 2 million infected people in Iraq, 300,000 in Kurdistan. Unfortunately, we lost about 5,000 citizens in KRI and 22,000 in whole Iraq. So, in my opinion, this is the major health crisis that we have. So my question to Dr. Wael, as you are the head and team leader of KRI Office for WHO, can you define what is health crisis management?
Well, thank you so much, and thank you, Mr. Choi, for the presentation. To tell you the truth, now like 2 years after you mentioned into the corona pandemic, we are reassessing exactly what is a health crisis. Initially, what is our impression to health crisis was man-made crises. So we were geared for the example of the Mosul crisis. When we were ready, we built mobile hospitals, and we deployed mobile teams, and we were ready for this kind of crisis because we knew more about it. We had the experience, we had the know-how. We had also the know-how with other like natural disasters such as earthquakes. We had the Haiti example where we learned a lot. We had the tsunami. All of this made us learn, and we were capable to respond quickly. When this crisis came in, it was unique. The last time we had a pandemic was the Spanish flu back in 1919. Our knowledge about the Spanish flu was limited. And keep in mind, we never had like the chance to acquire the information management system that we currently do. So all of a sudden, we are bombarded with this more than ever. I mean, like, that really created some tangible and resource like limited crisis for us. The first issue that we had to look into was the IHR, the International Health Regulation. And maybe Mr. Choi knows also about this because it was a contentious issue on how to deal with the pandemic. The International Health Regulations put some strict standards on what the countries will be doing in case of a pandemic. This, unfortunately, has not been adhered to. So now, like, based on this crisis, we have to revive and to review the whole process of the IHR. I mean, like, under the IHR, we should not close borders. But we were forced to close borders. Under the IHR, we should allow for freedom of movement. We could not do that. So now, like, maybe it's the time to go and reassess. And this is, I think, like what we should do in the next 5 years. Mr. Choi gave an example of Korea where they did not do a lockdown. And this is very important also to be reviewed. The countries that did a lockdown, a very strict lockdown, such as Canada, for example, or Australia. Australia is still in the lockdown. Did they reduce the number of cases? Maybe not. Maybe the example from Korea might be a bit more productive in that sense. I will give the example from the US. They did not enforce a lockdown. Still, the numbers did not increase beyond a certain threshold. So now we need to go back and to analyze the data from every single country and see what they applied and what they did not apply, and how this can be, you know, like the roadmap for the next 100 years. We anticipate that with the new economy that we're in, the world economy, these type of pandemic will never stop. Unfortunately, it's not like good news that I wanted to share with you, but it's the reality. Like with people traveling more than ever before, we would expect this like a pandemic to be replicated. Maybe it will not be the same, well, not with the same magnitude, but it will be another and another and another. And the only way to deal with that is by learning from the example of this corona pandemic. It's a golden opportunity for us now to review, analyze, and come with new standards. The thing is, we cannot do this alone. WHO, as the lead health agency, cannot do it alone. I mean, we need to work all together, as Mr. Choi mentioned. We need to bring in the countries to get the experiences from the countries, and we need some transparency. What we've seen also, unfortunately, not all countries were as transparent. And like you mentioned, the numbers from Iraq, I mean, like, we are proud to have more transparency in Iraq when it comes to the numbers, but we will see like neighboring countries who do not really share their numbers.
True.
And this is very problematic to us, because at one point in time, the world is becoming a small village. And if we do not share this type of information, we'll not be able to stop any pandemic. So now, like, we need to go back and to see what is the policies in terms of forcing the countries to report and forcing the countries to share information. Again, this is not, in a way, I mean, when I say forcing, not in the terms of like you would hold a gun and say like, you have to give me the information, but it's like the understanding, the international understanding across all nations that yes, it's in our best interest to share and to collect data, because toward the end, if we don't do this, we will all, you know, miss on the next opportunity, and we'll all be in the same position that we were in. COVID hit us all hard. And unfortunately, we lost so many lives. Many of those lives could have been saved. And we all personally know like of a family member, someone who passed away, unfortunately, because of this outbreak. Can we avoid this in the future? We should. And I think we are capable, but we have to sit all together, share the information, and come up with the new standards. And when I say share information, I think like what we discovered, and again, I'm taken away from Mr. Choi's like presentation, the bulk of the focus should be on information management. Without the information management that he presented, nothing could have been done. So now like it's the information technology era. If we do not take advantage of this, if we do not capitalize on the knowledge that we have and the technology that we have, will not be able to deal with another outbreak. Thank you. I'm sorry, like I took more of my time, but it's a bit passionate discussion that we have to talk about here. And thank you for the audience.
Thank you, Dr. Wael. Dr. Afrasiab, as Dr. Wael mentioned, this crisis is new. We used to deal with Mosul crisis, with IDP crisis. The Hague is a famous city to host hundreds of thousands of guests, whether IDPs, internal displaced people, or refugees. So this was the usual crisis that we knew before 2019. Adding to that, COVID crisis. Can you tell us the challenge that you have faced as the Director General of the Hague Health, and what are the steps that have been taken to manage this crisis?
Yeah, thank you very much. Thank you, Dr. Wael, Mr. Choi, for your nice information. Really talking about the health crisis, that if you started that facing a health crisis, that you have to prepare something urgent in your health system, and it's very difficult that already you have a crisis in your health system, that you have very restricted capabilities, that you're running on a very restricted number of hospitals, very restricted number of human resources, and lack in the financial management in the health system that we face it and experience it in the DOH. And started since 2012 that we're facing a huge number of IDPs and refugees. Within 1 month, the number of population of the Hague become the double, from 1.2 to 2.2 million living in the Hague. Still, most of them are still living there in camps. And then the ISIS war started, and then the coronavirus also pandemic case started over all the world and the Hague also. So the challenges is how to push the very restricted capabilities with the human resources, with the finance, and already you have a health crisis that we have, that we all know that we have a bad management in the health system, that we are living in an unsafe work environment with the health system in our hospitals, and unavailability of drugs and machines, medical equipment, and maybe that we cannot serve our people with very restricted space or number of beds or hospitals. So all these are challenges that we faced for the last 8 years, and we push our health system and health institutes in the Hague that do serving our people, and also starting with the coronavirus. Of course, that was very difficult, starting facing the corona. That's something very new in over all the world, and especially for us. In addition to that, we know that the public health is that we have a very big problem with the public health, that we haven't any system in our health systems that we have specialties or can manage such a big crisis or such a pandemic case of corona in our health system. So of course that with planning and to see what capabilities you have, and of course with the support of the government and with the international and national agencies who help us and push us with the experience and with medical equipment and with some construction, like increasing the number of ICU beds in Duhok, that help us to cover at least what we can do with the corona cases. The second thing is that we face it was very difficult, who gonna be admitted to the hospital. It was very difficult because some cases, once they got corona, they decided to admit them to the hospital. They haven't need to any oxygen, or they don't need any drug. But the first experience that started with corona, it was like that anybody who is positive should be admitted to the hospital and should start treatment. What guidelines put it over all the world, and all the contacts should be quarantined for at least 15 or 20 days and do full investigations. So this was the first. After the second wave and the third wave, we decided on depending on the specialists who we have on Duhok and on the guidelines and protocols of the Ministry of Health, that who need to be admitted, the number of cases has been decreased, that we don't need to admit any case with only positive PCR. What we did in Duhok, and we faced the last wave, that we increased the number of investigation PCR in Duhok, that we reach 8,500 PCR tests per day in Duhok. That we put a plan that as much as possible we can diagnose cases, that we aware the people and the contact persons, that you have a contact with a person, he is positive or he is diseased with coronavirus, that we aware the people, that we detect the cases as much as possible, and the cases will take care of themselves. Who is positive will not go in contact with other people. And in our plan that we put that we will detect as much as possible the number of cases, that we shorten the wave of coronavirus. And already that would happen with the third wave in Duhok, that we see number of cases in Duhok now, they are decreasing, while other governments in KRI and Iraq, the number of cases are increasing. Of course, this is one of the objects that we could do it for the coronavirus and facing the pandemic of coronavirus. As I said, that it's very difficult to push and make a system with a health crisis facing another crisis. That's very difficult, that you have a shortage of human resources, shortage of capabilities, non-experience, shortage of drugs, and many things that we have shortage in our country. Anyhow, that overall, that the increasing of the number of cases and increasing the number of death rate, that we didn't exceed 1.3 death rate in Duhok.
Thanks.
That we did it in Duhok for coronavirus, in addition to the other crises that we face it in Duhok also. Thank you very much.
Thank you, Doctor. Dr. Faris, from legislative point of view, as you are the Vice Chair of Health Committee in the Parliament, in your opinion, whose responsibility to manage health crisis? Is it MOH alone? Any role for decision makers, government overall, the Parliament, neighboring countries?
Thank you very much. I want to give the permission. My presentation will be in a local language, either Arabic or Kurdish.
Hiç geçen kaptır, hiç geçen.
It's the two language of the parliament, yes. بديت نعم طبعا أموك لجنات هندرستية البرلماني عراقي هذا خلا دوية استذاب إنه سيستمي عراقي سيستمك يقالك لوازة سيستمي الصحي طبعا وأسباب وأجرد في لوازية سيستمي صحي عراقي قالك يعني أجر وقالك أسبابتين إيكي شوان طبعا كيماسية أو بادجت أبيتي تترخان كرن أو موازنين تنا ترخان كرن بو إدامة وبيشكفنا خدمات تندرستية يعني بونا موازنة عراقي قالك صار 100 مليار دولار جفي مبلغي كوجمي زبلاح تنها بنت صدي تيتا ترخان كرن بو وزارة ساخلمية عراقي طبيعي هذا سببك أسبابي ديجي قالك لوازية إدارية يعني أم بعربي بيجني سوء الإدارة في وزارة الصحة أفجي طبعا أف حكومات تبرينك شدو وزارة سيحة نوكا هروسا موضوع لا مركزيته مد برخود داي مهمية أف ومدهبو أف أملهبو كأنه لا مركزيات دي بيتا سيستمك جونجاي بو عراقي يعني هر محافظيك خبرة بد بل على العكس بداخة وديار بو كل مركزيات الدائرة تندرستية دائرة عراقي زيادة تأثير وكارتي كرناك خراب السيستم الصحي العراقي كر طبيعي موضوع أكيد يجي إنه بداخة هذا قالك آري شبو عراقي شبون وقالك كرايسز وأزمات شبون بل حدانك العراقي أمد بيجني هيئة كوارث وطنية هيئة كوارث وأزمات هيئة كوارث وحالات طارئة العراقي ناطية شكرا تنها خلية الأزمة أم بيجني شانا قيرانا هاتا قريدان دسبيكا يا بلافبونا كورونا بل أذي خليه يجي حقيقة يعني هو ساكاريخ ونكر بيشكلي أبيبو بيويست أم برخد ديني كو عدم تعاون يعني تنسيق هم هنجينينا نعبينا وزارة الصحة ونعبينا في وزارة الدين بونمونا مثلا بوجيك ديتا ترخان كرن بوزارة الصحة بل بداخوا وزارة الدارية يا عراقي وزارة المالية نيا متعاونة لقال وزارة الصحة مثلا أف باريتنا مزخترن بو وزارة الصحة ممكن بيشتي شاش هيفا بين صرف كرن هروسا طبعا هجرة العقول يعني أف كوجبونا يا دكتورة ويا أف بلا بيجن خبراء صحيح همي شونا درفي عراقي البر فان مشاكل أي بسري بلدي هاطن طبيعي هاريكاريا خلكيجي يعني مسؤوليتك جماعية هاريكاريا هولاتية الجل أفرين مايتنا دانان شلاي حكمتها مفروضة تنسيقك وهمهنجيك تفاهمك برفرحت الحبيب في باريدا بالنتيجة يعني عراق ناسر كفتبو كنترولا بتا يا كورونا راستي حقيقة موضوع أكيد يجي طبعا أبيكو زيادة باري أريشب بار جرانتري لكر أف محافظات يتهاطينا ريزغار كرن دستي داعش دا مثلا أذنين ويا صلاح الدين أنبار بشكش كركوك ديالا أذان أصلا بنماية تندرستي يعني بنا التحتية الصحية زور هاد بنا تدبير كرن يعني الطاقة السريرية مثلا بو محافظة نينوى بري احتلال داعش 4000 حتى 5000 بيت بو بشتي داعش هذا خارب بو 1000 طبيعي أم فان فاكتور أخرى أم ليك دين أذا أسباب رئيسينا كو عراق بديت نامن ناسر كفتي بو إذ كنترولا بتا داعش دا وبديت نامجي تش أزماك آين دي تشي بيت تش كرايسزك قيرانك آين دي تشي بيت هاديسا دي آثارتوي السلبي بن چونكول برفان فاكتوروفان عوامل ويتمنوك بعسكري. Just few words in Arabic if you don't mind.
Sure.
Yes.
أكيد دكتور.
طبيعي النظام الصحي العراقي هو نظام متهالك، نظام هش، وغير قادر على استيعاب الأزمات التي تحدث بالبلد، وخير دليل على ذلك طبعا الأزمة الأخيرة أزمة كورونا والأسباب كثيرة. عقود من الزمن هناك صراعات سياسية، هناك حروب، هناك شح في الموازنات والموارد التي تخصص إلى وزارة الصحة. لا توجد هيئة وطنية للكوارث وللأزمات وللحالات الطارئة تعنى وتتصدى لهذه الأزمات. كل ما تم تشكيله هو خلية أزمة، ولكن للأسف هذه خلية الأزمة لم تستطع القيام بواجبها لأنه لم تكن باقي الوزارات متعاونة معها. على سبيل المثال كانت تخصص مبالغ من مجلس النواب العراقي لأجل التصدي لجائحة كورونا أو لأجل تأمين الأمن الدوائي أو الوصول إلى التغطية الصحية الشاملة. للأسف لم تكن وزارة المالية متعاونة في صرف وإيصال هذه المبالغ إلى وزارة الصحة لكي تستطيع أن تقوم ديمومة العمل وديمومة الخدمات الصحية. النقاط الأخرى طبعا سوء الإدارات المتعاقبة كما أسلفنا. لذلك بصراحة النظام الصحي العراقي يحتاج إلى ثورة حقيقية، ثورة إصلاح، ثورة تطوير الخدمات. يحتاج إلى إعادة النظر في الكثير من الإدارات اللامركزية التي كنا نأمل أنها سوف تكون بوابة خير على العراق. للأسف أنا برأيي وكعضو لجنة الصحة كانت تجربتنا سيئة مع تطبيق اللامركزية. تدخل المحافظات بدون علم، بدون أسس علمية في صميم عمل دوائر الصحة أثرت بشكل كبير في تقويم وفي إدامة وفي إصلاح النظام الصحي. لذلك طبعا أكرر نحن في العراق بحاجة إلى تأسيس هيئة كوارث وطنية عليا كما في الدول الأخرى لكي تكون مستعدة للتعامل مع الأزمات الطبيعية، الأزمات المصطنعة، الكوارث المرضية وغير المرضية. شكرا جزيلا.
شكرا دكتور. Mr. Kwang, Your Excellency have mentioned that T for Together in Solidarity. Korea has thankfully donated to Iraq and to KRI, I think $400,000 worth kits to KRI and then $800,000 worth for children in federal Iraq. What is the message? How can we encourage other countries, friend countries, neighboring countries to do the same, to help Iraqi health system managing their crisis?
Talking about the health system and the cooperation between Korea and Kurdistan, maybe we can trace back to the 2004 when the Jeytun division was stationed in Kurdistan. We already support the construction of the Jeytun hospital. Maybe everybody here in this hall, they ever heard about the Jeytun hospital. From that time on, Korea was a full supporter for the independence of the health system in the Kurdistan. And then we continually donate lots of human resources and finance supports during the past 17 years. Very recently, we are also supporting to the IDPs and refugees in the Kurdistan region also. And in the time of the pandemic, we also support the Kurdistan government regional government to overcome the obstacles by way of, as you mentioned, the testing kits and also as well as we also provided a web seminar because a lot of countries, they request the Korean government to share this kind of valuable information to cope with the coronavirus. So with this demand, so we supplied a lot of web seminar to the whole global government officials, including Kurdistan government officials also. So now, what I mentioned before, the one team between the government and the citizens, I think the communication system is much more important. In the first session, I also listened to some presenters' idea and some topics he would like to address is that the most important thing is that how to have a direct contact with the people and the people can raise their idea to the government and they should they should interconnect, and interact between the two, and for the ultimate goal to cope with any difficulties, any disasters in the future. So this is my idea. Thanks.
Thank you very much, Mr. Kwang. My last question to Dr. Wael. Hopefully COVID will go, but there will be another COVID. There will be another pandemic.
Crisis.
There will be another crisis, let's say. As WHO is supporting the reform in our health system, do you think we are ready for, God forbid, for any future health crisis? And what are the steps that we can take in order to avoid or to better manage the health crisis?
Currently, and again, I agree with Dr. Faris, we are not ready. Unfortunately, the health system is still it needs to fully recover, and we need to put more emphasis on so many issues that we felt from this experience that it was not going well. So the first thing that we can do is to evaluate our response, to see where the gaps are. And I think it's a process. I mean, we cannot really do this at this point in time, but we will start and eventually we'll come up to know exactly what worked well and what did not work well. But I will give you the example. I mean, one of the things that for us as a priority now as WHO is to establish an emergency operations center. The emergency operations center will be the focus of this crisis management, at least at the level of the health ministry. Again, as Dr. Faris suggested, it can be something beyond this, but from our own perspective as health, we need to have a center where all the information will pour in and we'll be able to analyze and to see if this is a crisis in the making or not. We need to know also what type of services we can avail based on our own capacities. This is all to be somehow grouped into the Emergency Operations Center. This Emergency Operations Center should be at the level of Baghdad, Erbil, and even at the level of the governorates. And there should be good connection between all of those Emergency Operations Centers. I think this is the first step. The list is endless. I mean, we can definitely learn more and more and more. But at this point in time, we feel this is the priority, and this is where we need to put our emphasis on.
Thank you very much, Dr. Wael. I think we have only 10 minutes remain, so if we can take a few questions from the audience, maybe up to 3 or 4 questions.
We have 3 people, 4 people actually.
Perfect. First question is from Dr. Osman Jamal.
Thank you very much for all. My question is for Mr. Kwanj. I asking about in Korean, who is the decision maker in health crisis like Corona, for example?
Okay, we have a good governance because, as I mentioned already before, we have already experienced 2 crises, one in 2003, SARS, and 2014, MERS. After this crisis, we got a very precious lesson that we have to make whole of government action, including people's active participation to this global pandemic. So now, if you look at the Korean people are very, very active to participation in the kind of social distance policy, and they also follow the government's guidelines to follow. So, and then our Prime Minister, he's always preside the conference every day, and then the government official, they announce the current situation daily. They have a daily press release, what's happening all over the country, and what actions are needed, and we ask the people to active participation in this kind of policy. So this kind of byway cooperation and coordination between government and the people are very, very important to, at the end of the day, win over the crisis. George Bass.
Thank you, Mr. Kwang, and thank you, Dr. Osman. So the responsibility is for all. Dr. Sahand is having a question. Dr. Sahand?
Greetings, I'm Sahand from IFMSA Kurdistan, and thank you for the panel discussion. I had a question. How do you think that health-oriented NGOs can help the stakeholders in managing health crises? Because we're a medical and health-oriented organization, and we could definitely use your expertise. Thank you.
Thank you, Dr. Sahand. So, Dr. Faris, if you reply to question of Dr. Sahand.
يعني براستي يعني أجر دوري أنجو نبا في النظامات الدولية العراقية رأيه من أف باردوخي عراقي دا دقلك لواستر بيت ودقلك بتر يعني مدار سيدار بيت وممكن يجي رجال مرني وجيون دزداني دقلك زي تليت شونكو دي سودي بيجين أولا عراقي شخ بلانك واضح نبو كو تعاملي سردارية القل في أزمة صحية براستي يادو بيجي طبعا أكر أنبينا أفريجت عالمي يعني هر هزار مروفا دبيت هشت بيت هبيت مقابل هزار مروفا يعني 8 بيتس for every 1000 people بداخل والعراقي حتانوكا درباسنا بيه 8.5 بو هزار مروفا طبعا أفا شورتجا قالك يا مشكلة يادو بيجي يعني number of doctors يعني إحصائيات عالمي دبيت مثلا 4 دكتور for every 1000 people بيت أبا العراقي طبعا حتانوكا 8.3 مجا طبعا أضع عوامل أخرى كتوليك داي جهودة منظماتنا خاصة طبعا WHO يعني كنا بيجن يعني أمشى نازي يعني نكون لهم الاحترام والتقدير هكا أو نبا أف أزمة كل عراقي تشيبوي أف مشكلة كل مناطق محرر أو ترزقار كري بن كنترول داعش دي ساعة بحثي مثل كمحافظة كمظنة 4 مليون مروفة مثل دا حقيقة بداية التحرير جهودة حكومية جهودك قالك لا وازبو بداخوا طبعا بالمقابل دورة أنجو منظماتها أوان كارك قالك بيروسكر يعني وكنا بيجي نتائج قالك بيروز أو نبان دا حتى في دقيقة دا محافظة نينوى والكثير من المحافظات الأخرى دا توضعك قالك لا وازدابا شت منيت مثلا حكومة العراقية تنسيقك برفرح ترقى الوان بكت يعني تقديم هاريكاري مثلا تسجيل موضوعي هاتنا شون هوا تسهيلات اف تشتيت لوجستي طبيعي دبيت لازم البردوان بن و ام دسخوشي الوهميات كي
دسخوش كاكتور دسخوش دكتور سهند we can take one more question from Dr. Tara.
Hello, and thank you for the opportunity. I don't have question. I just have some few suggestions, which I feel like, from my point of view, I am biomedical scientist from North Kent Pathology Service and member of Quality Assurance in Healthcare Management. I have some suggestion. First one that I am really focusing on is information management system, which is really crucial for this one because in this way we can have everybody's information stored in our system, and then which is later on this is important to monitor, to have everybody's information, and also a system that we can track people's like in UK we have NHS COVID, NHS apps, we have a good information management system in our health system, which we can store everybody's information. I am working in laboratory. When we receive calls from patients, from doctors, from clinicians, easily we can access everybody's information and track everyone's health. And when we have urgent result or urgent circumstance, easily we can access patient information through PASS system, where we can send ambulance or we can give them urgent suggestions so they can bring back patient. They know where they live, how to get them the easiest possible way to give them. So this is really important, and also it is important to put people to education. First of all, we need to educate ourselves to be able to educate others. Participating in continuous professional development is really important, is crucial. And we need to also focus on schools. That's another way. Be able to give free flow cytometry, flow test for COVID. Vaccination, that's another one. You know, like which dose of vaccine they had, first one, second one, and be able to give third one to those people who got autoimmune, who they have like a weak immunity. You know, there are many suggestions. But first of all, to be able to do all of these, information management system is very crucial. Thank you.
Thank you very much, Dr. Tara. So correct, information and education. Without information, we will not have research.
Exactly.
And we have research, no development. Thank you very much. Last but not the least, Dr. Zana Mahmoud. Last question.
Thank you. Thank you for your nice discussion about this panel. I have a comment and a question to Mr. Choi. So my name is Dr. Zana Mahmoud. I have PhD in infection and global health and specialized in coronavirus research. I think my comment is a crisis in health crisis is public engagement actually. So we have been in that crisis, in this crisis from the first day last year, and we've seen a really major crisis in public engagement. So people didn't understand and haven't understand still, even in testing by PCR, even in like vaccination as well. So, and my question to Mr. Choi, have you got anything like this in Korean public? That people got resistance to some kind of government's decisions or any policy or any, trials to combat the crisis in your country? Thank you.
From the beginning, as I already introduced, that Korea's civic responsibility is very high, especially in the pandemics. Most of the people follow the government's regulation and the guidelines, and every social policies should be followed by all the people. We didn't see any single breach or other loopholes in our policy. So what I can say is that Korea is a democratic country, and then this government was established by the people's revolution. Not, how can you say people's movement? Sorry, revolution is too sensitive. So people's strong participation against the government's policy. So this government was established by the people's choice through the legitimate election. So we have a very, very high, high definition of the people's participation in the policy. So government and people can be, say, one team, and then in whatever matters, if there is any certain target and ultimate goal, government and people became one and continue to fight for the final goal. Thank you.
Thank you, Mr. Kwang. Thank you, Dr. Zana. Once again, I would like to thank our panels for this great discussion. You honored us today. Dr. Wael, the head of KRI Office for WHO, Mr. Kwang, Your Excellency, from the Korean Consulate in Erbil, Dr. Afrasiab, the DG of Duhok Health, and Dr. Fars Brifkani from Iraqi Parliament. Thanks a lot.